Good afternoon, everyone. Good afternoon, students. Good afternoon, madam. Good afternoon, sir. Good afternoon, all of you. Students, please inform to your friends. Let them join the section. Within 3 minutes, the class will be start. Students, please inform to your friends. Let them join as early as possible. Within 2 minutes, the section will be starting. Today, YouTube Live and Facebook Live is also going on. Please check it. Students, please inform to your friends. Let them join as early as possible. Within 1 minute, the section will be start. Today, YouTube and TV is also going on. Check it. Madam, you can continue.
Good afternoon, everyone. Welcome to the second day session on introduction of injectable packaging and evolution of delivery devices. So before jumping into our next session, I would like to do a small recap of our yesterday's session. So yesterday the first session was on West introduction, which was taken by Mr. Algu Subramaniam, who is a managing director of West. After he gave an introduction overview on West products and the service offerings, and also gave us a small overview on the injectable packaging. So the next session was taken by Mr. Vikrant, who is a senior technical account specialist and responsible for providing technical assistance to West product, process, service portfolio, and support multiple accounts and business teams. He took a session on overview on drug administration and packaging systems. In that, he covered the various modes of administration of drugs, injectable and pharma administration, drug administration and packaging system, and the various type of packaging systems. Today, Vikrant will be taking the next session. It will be on understanding of elastomers, stopper design, manufacturing, and processing. Over to you, Vikrant.
Thanks, Kriti. Hope you can see the slides.
Yes, we can see your slide.
Okay, thank you. So good afternoon, everyone. So we are on second day. Yesterday, we see a general overview of injectable packaging and devices offered by West Pharma and then I covered few aspects on route of administration. So we are seeing two routes: enteral route of administration and non-enteral route of administration. So in enteral we saw oral route, and then sublingual route and rectal route. While in case of non-enteral route, we saw different injectable routes like IM, IV, SC, like intravenous, intramuscular, subcutaneous, and intradermal route. So transdermal as well as nasal route also comes under non-enteral route of administration. And we saw the details on packaging device for injectables, like we saw ampules, we saw yesterday vials, there are pre-filled syringes which is having two different segments. One is with intact needle, the other is with lure technology, one with slip or one with lock. And we saw cartridge also is another way we can deliver the drug, which goes inside the devices or inside the pen. And we also saw the blowback technology mainly for saline bottles. So that was just a overview of route of administration and what are the packaging devices what we are going to see. So now we are going to jump on the understanding of elastomer, stopper design, manufacturing and processing part in details. So before that, what is parenteral packaging? So I just put a definition of parenteral packaging. It is a aseptic manufacturing of parenteral drugs incorporates the process of filling a drug product into a container, such as vial, in a highly controlled aseptic environment and maintaining that environment during storage through the use of additional closures such as stoppers and seal. So the most important aspect in parenteral packaging is your aseptic condition. So you have seen aseptic manufacturing, controlled aseptic environment. So this is very crucial when you are talking about parenteral packaging. Sterile and aseptic, you will hear more because the drug is going directly
Excuse
inside
me,
the
sir.
body.
Excuse me, sir. Your PPT is not visible, sir. Sorry.
Okay, sorry. Yeah, can you see now?
It is blank, sir. Yes, sir. We can see now. It is visible. You can continue, sir.
Okay, thank you. So, in parenteral packaging, aseptic manufacturing, controlled aseptic environment, and sterile word is very important because your drug is going directly inside the body without going in your GI system. So that is the reason aseptic manufacturing and controlled aseptic environment is crucial while formulating parenteral packaging. So why we need parenteral packaging? Because you have to carry your drug to a patient. So packaging component are an integral part of drug product. Selecting the right packaging system is not trivial. It can impact patient's health, operational efficiency, drug compatibility, and drug stability. So why parenteral packaging is so crucial? Because it maintains the stability of the drug product. It protects the drug product from various external factors such as microbial ingress, light, oxygen, H2O2 and particulate. So if your drug product is light sensitive, you can see your ampules or vials are generally amber in color. So this is why this parenteral packaging is so crucial to protect from light, oxygen, water and particulate matter. And it provides safe, easy access to sterile product to the patient from manufacturing product area. So we are going to see more on details on this vial containment system. So you can see in the slide there is a glass vial, and this is a stopper, and this is a seal. So this vial can be made up of either glass or polymer. So polymer, which will be cyclic olefin polymer. So we have a CZ crystal zenith polymer where we can produce this vials, or these vials can be made up of glass. And this is the stopper, what we call it as a rubber stopper or elastomeric stopper. So this rubber stopper and this vial container is having a direct contact with your drug. That is the reason these two products are called as primary packaging system, because it is having a direct contact with your drug product. So this vial is also in contact with your drug product, and your rubber stopper is also having a direct contact in your rubber stopper. The seal is called as a secondary packaging because it applies on the top of this stopper. So it is not having direct contact with the drug, it is on the top of the stopper. That is the reason this is called as a secondary packaging, which you can see it is made up of aluminium, and on the top you can see polypropylene button on top of that. So what we are going to see now, a detail on stoppers version. So this elastomeric or rubber stopper we are going to study in detail in this session. So in the content wise, we are going to see what kind of material is these elastomeric are prepared of, what is the manufacturing process and control, what are the consideration in selecting a prime packaging component, what are the regulatory requirement, factors for consideration, different coatings and lamination, different design, post processing and packaging. So these are the general topics which we are going to cover in this session. So what is an elastomer? So elastomer is an amorphous polymer with a viscoelastic characteristic existing above its glass transition temperature. So this is elastomer is an organic polymer possessing elasticity to the extent of nearly 200 to 300%, which is having a high amount of elasticity. That's the reason we call it as elastomer or rubber. So the rubber get elongated on stretching and get back to original position on dimension on a removal of stress. So whenever you see there is an unstretched rubber, when you apply the stress, your rubber gets stressed it. And when you remove the stress, your rubber will get on original position. So this is an important part. Why? Because your needle is going to prick on the top of the elastomeric version. So when you apply a pressure or stress on the rubber stopper, there is a applied stress because your needle is going to force inside the stopper. So the rubber gets stretched, and when you remove the needle, it will get a release of stress and the rubber is back onto original position. So that is the important aspect of these elastomeric stopper. This is mainly used, this elastomeric rubber should be having a good amount of flexibility. So whenever you are putting that needle inside the vial along with this rubber stopper, there should be having good amount of flexibility, good amount of elasticity, and that's the reason that needle can go inside the stopper. And when you remove the needle, it should be it should come back to its original position. So it should have a good amount of strength. It is also impermeable to water and high resistance to abrasion. So these are the one which is very important when you are talking about elastomeric versions. So modern formulation contain no natural rubber due to allergy concerns. So in previous days, these rubbers are made from a tree called as Hevea brasiliensis. So this is the tree generally prepare a natural rubber, but nowadays no one will use this rubber for manufacturing of this rubber stopper. So all this rubber elastomer, what we are going to see is of chemical in nature, not natural in nature. So this is made up of various monomers which is coiled in the form of spring, and that's the reason you are going to get elasticity. like I explained, we are not going using this natural rubber. We are using only chemical rubber. In the chemical rubber also we have two different segments. So one is saturated, the other is unsaturated. So example of saturated elastomers are butyl or halobutyl, and examples of unsaturated are kind of a natural rubber or isoprene. Sources, like I explained, natural and synthetic, and molding process. This is also important. Whenever you are preparing this rubber stopper, there are different steps. So thermoset and thermoplastic. So for whatever we are going to study now is a thermoset, uh, which can be made up of compression molding or injection molding. While in case of thermoplastic, you are generally going to use injection molding. So thermoset is a polymer where you need a light amount of cross-linking agent. So you see all the polymer which is having a thermoset in nature, it is having cross-linking agent. While in thermoplastic, you will not see any cross-linking agent. So these are various types of elastomer. So in terms of ASTM nomenclature, you can call it as NR. NR is your natural rubber. IR is your synthetic or isoprene rubber. BR is butadiene or butadiene rubber. SBR is a styrene butadiene rubber. CIIR or chlorinated isobutylene isoprene rubber. BIIR is a brominated isobutylene isoprene rubber. EPDM is ethylene propylene diene monomer. So these are the various rubber generally used for manufacturing of this rubber stoppers. So whatever we are going to study is mostly on butyl or halobutyl rubber because it is having excellent oxygen and H2O barrier properties. So now we are not going to study on these silicon rubber or SBR rubber. We are most of the rubbers what we are manufacturing is of butyl or halobutyl rubber. So in the halobutyl version, we are putting a halogen, either chlorine or bromine. So the chlorine version we call it as a chlorobutyl rubber, chlorobutyl isobutylene isoprene rubber, or if it is bromine, then brominated isobutylene isoprene rubber. So CIIR stand for chlorinated isobutylene isoprene rubber, while BIIR stand for brominated isobutylene isoprene rubber. So these are the monomer. So this is the chemical structure of monomer, and this is a continuous chain. So it is equal to N. So this chain can prepare a polymer, and this polymer is having a spring-like structure. So these are coiled in the form of spring, and that is the reason all these polymer are elastic in nature. So why we are going with the butyl or halobutyl version is because they are having a better chemical cleanliness and stability. They shows a very low amount of extractables compared to isoprene, which is IR rubber, a good barrier to oxygen and water, reduced functional properties and performance. So these are the examples or advantages what we are going to see by using this halobutyl version. While in case of IR rubber or NR rubber, which is polyisoprene rubber or natural rubber, it is it is earlier days it was using, but now it has shown various cytotoxic natures, especially in terms of natural rubber. So that is the reason industry is stopped using any natural rubbers for injectables. So what are the critical attributes of these elastomers? So there are four different critical attributes what we identified. So it should be chemically consistent, meaning it should be compatible with your drug. So whatever drug, whether it is acidic, whether it is basic, it should be compatible with your drug. So the rubber stopper should not interact with your drug. That should be compatible. A critical dimension can impact sterility and integrity. So whatever rubber stopper we are going to put on the glass vial or plastic vial, so it should not impact the sterility or integrity of the packaging system. It should not in terms of particulate embedded or loose. So whenever you prick any needles on top of this rubber stopper, it should not give any particles. So it should not, whether it is embedded or loose, there should not be any particles. So this is also important. So once you prick the needle inside the stopper, there should not be any particle. So this loose particle goes inside the drug solution, which will create a big problem. So that is also a critical attribute while selecting this elastomeric rubber stopper. Intact film and proper placement can change chemical interaction with the drug. Like I said, if your drug is having a very acidic or very basic in nature, that can interact with your stopper and will produce any kind of a leachable or extractable, which is kind of not good for your final dosage form. So that should not happen. So these are the 4 critical attributes while selecting a proper rubber closure for your parenteral drug administration. So moving to elastomer component manufacturing, how we are going to prepare, how we manufacture these elastomeric parts. So if you see any formulations which we generally prepare is having a certain batch manufacturing record. So you can say this is a ingredient and this is a function, and on the other side you will know what is the percentage and how much amount it is added. So there are the list of ingredient and these are the functions. So elastomer is the one which is having a most 80 to 90% component in the rubber stoppers, so which will impact its physical and chemical properties. We can also add curing agent. So like I said, these are thermoset. We need to have a cross-linking agent in that. So a lightly cross-linked material is the one which we add. It is a curing agent. Then accelerator. These are the one which accelerate the cross-linking during the formulation of rubber stoppers. Activators, efficiency of accelerator. So to avoid any anti-degradants, we also add the antioxidant in the formulation. To aid the processing, we also add this plasticizer, some amount of fillers to make it easy in terms of physical properties, and a pigment. So whatever color, if it is a gray, so we add the pigment gray color. So color is also integral part of this elastomeric formulation. So each batch, whatever we produce, is having different amount of ratio. So one batch we put 80% of elastomer, the other batch is 90. So it depends on the formulations. So each batch is having a different set of percentage of elastomer of these ingredients, and we can adjust basis on our requirement. In terms of manufacturing process, you can see all these raw materials and auxiliaries we add in a one chamber. We first weigh it. So all the materials we first weigh it, and then we mix it in a big tumbler, and then once it mixed, all ingredients are mixed, we do a calendaring. Calendaring meaning we are putting in a form of sheets. So all this material has to be done in the terms of calendar. So we are putting in the sheet, and then there is a molding. So there is a compression molding. So whatever size you want, you can just mold that, and you can form the size, whether you want serums or whether you want a Lyo stopper. So that mold should be applied, and then finally a trimming. So there is a big sheet. So you need a small stopper, So there is a trimming of each stoppers, and then finally washing, and then packing and shipping. So this is the standard process of preparing elastomeric stoppers. So for each step, you can see there is a check, a QC check, a quality control check. So while in case of weighing, there is an incoming control. So there is a QC person who check right amount of all the ingredients are added in the formula or not. In terms of mixing, there is a mixing control. What is the RPM of that mixing tumbler. So that is also checked by our QC team. Then in terms of molding, there is also molding control, which is monitored by a quality control. And there is also trimming, which is also in process. So every step you can see there is one a quality check, which is controlled by our quality team. And then there is a final inspection, and these samples can be given to lab for analysis. So that is the way we generally prepare our elastomeric stoppers. Like I said, for raw material, there is an incoming check, that is ash content, which measures the amount of inorganic compound present in our raw material. And we also check the rheology, which is flow properties of rubber during curing. So these are the incoming check for raw material. For molding stage, we generally check the specific gravity, which is the density of the material. Then show a duro, which measures the hardness. So what is the hardness of that stopper we need? So that is also an incoming check we generally check for each lot. Dispersion, in case of mixing, whether the whatever the ingredients we added had been properly mixed or not, whether it is homogeneous or not. So that is the reason also we take the dispersion and check the homogeneity of all the ingredients. And finally color, check, so whatever the color we added, whether that color has mixed properly and uniformly. So all these checks has been done by our quality team. So consideration in selecting packaging components. So now till now what we have seen is what all the ingredients are generally present in your rubber stoppers and how it is going to manufacture and how we are going to check it. So now what are the consideration in selecting packaging components? So if you see, there is a regulatory guidelines. So there is a 21 CFR 211. So Code of Federal Regulation, where your drug product container and closure should not be reactive, additive or absorptive so as to alter the safety, identity, strength, quality or purity of the drug. So whenever you are using any container or closure, it should not react with your drug, it should not be additive or it should not be absorptive. Why this has been important? Because to maintain the integrity of your drug throughout the shelf life of the dosage form. So that is why US Code of Federal Regulation, they put these guidelines. So whenever you are preparing any kind of container closure, it should not be reactive to your dosage form. There is also guidance for industry which explain that whatever you prepare for container closure, it should be suitable, it should protect your dosage form, it should be compatible with your dosage form, and the final dosage form considered safe for use, and it should have high performance features in addition to containing the product in an assembled container closure system. So this is the guidance for industry which US FDA has been recommended for preparing any kind of a container and closure systems. Consideration for selection of closures. So like I mentioned, this is a very important steps. So as a technical customer support, whenever we interact with any pharma companies, we generally check whether what kind of API it is, whether it is acidic, basic, what all the characteristic of that API it is, what kind of preservative they are adding in the formulation. What is the solvent, whether it is aqueous, oil or organic or inorganic solvent they are using, what is the final pH of the formulation they are taking, sensitivities, whether they are sensitive to any metallic ion, that also we check it from the drug manufacturer, and what is the final dosage form, meaning the final dosage form they are giving in liquid form or powder form or lyophilized form. So this is a very important aspect in terms of formulating any pharmaceutical dosage form, and this information we gather it from pharma manufacturer and provide a recommended stopper basis on the information provided by any drug manufacturer. So another set, we also check whatever they are mentioning, we also check whether there is absorption, is there any leachables or permeation. So what is meaning of extractable and leachables? So extractables are the one which is generally get it from the stoppers, while the leachable are the one which is kind of arrived when is contact with the drug formulation. So, the definition of extractables are the compound that can be extracted from individual component of a packaging system under stressed condition. So, extractables are generally we get it from the rubber stoppers, while the leachables are the extractable that migrate from the packaging system in drug product during storage. So leachable are generally observed when your drug product is in contact with your rubber stoppers. So consideration for selection of closure for lyo application. So this is one process which I explained yesterday, lyophilization. So lyophilization is the process of removal or process of water removal used to preserve a perishable drug product to extend the shelf life of the drug. So there are few drugs which are sensitive to moisture, and for that you have to remove the water present in the formulation, and mainly to preserve for an extended period of time. So in that case, what lyophilization they do is they do a four stages are there in lyophilization. First is pre-treatment, second is freezing, third is primary drying, and fourth is secondary drying. So these are the four steps generally drug manufacturers do for getting a lyophilized version. So in the case of freezing, they generally do this freeze drying technology at around a temperature of minus 50 to minus 80 degrees Celsius. And after that, in the primary drying, what they do is they lower the pressure, and in that case the sublimation start. And because of this sublimation, there is a partial vacuum generate inside the vial, and it removes the water molecules. And at the secondary drying, the unfrozen water molecule has been removed. So these are the generally four steps which is generally done by drug manufacturer to remove excess amount of water in the drug formulation. So in that case, as a elastomeric formulation, we need to be extra cautious with the moisture. So this process, the excess moisture has been removed. So there is no moisture present in the lyophilization version. So in case of rubber formulation, whatever we are recommending, the moisture should be very least. So moisture vapor transmission is the important criteria while selecting a rubber closure for lyophilized application. Physical properties is also important, fragmentation or reversibility, meaning you are putting a pressure through needles. So after putting the pressure through needles, you are going to get few amount of fragments. So that fragmentation study is also important. That fragment should not go inside the drug molecules, and these fragments can react with your drug. So this is an important study generally we follow. And then resealability. So once you insert any needle, and when you remove this needle, it should be automatically resealed. It should not be any hole or any kind of a leakage should not be there. So there should not be any leakage. So this is two important segments we generally study. Like I explained, chemical properties, leachable and extractable, and absorption and adsorption. So this is also important properties whenever you are selecting a closure for lyo application, lyophilized version. So what are the sources of moisture in stoppers? So like I explained, moisture is a crucial role you need. So in the formulation, the moisture should not go inside the vial. So moisture is a crucial whenever you are dealing with lyophilized version. So moisture can come from environment, which permits through stoppers, which is what I call as moisture vapor transmission. moisture which can enter via stopper vial interface. So in between also moisture can go inside the vial. Residual moisture, meaning it can be in the rubber formulation during sterilization phase or during drying stage. So these are the ways by which your moisture can go inside the vial and can react with the lyophilized version. So you need to be extra careful whenever you are dealing with lyophilized versions. So moving to coatings and laminations. So these rubber stoppers are coated there are actually two different coating. One is for lubricity and the other is for barrier films. So whatever rubber stopper you see, it is either lubricated or either given a barrier film. So lubricity is mainly by using silicone oil or via B2 coating. So I'll take you through in detail what is the silicone oil and what is the B2 coating is generally done for lubricity. And the other version is for barrier films. So if your drug is very kind of sensitive to these rubber stoppers, we put a barrier film on the top of these stoppers. So that films are generally fluorinated polymer films. So there are two different films we have, FEP or fluorotec. So these are the two different films we generally provide in a barrier version. So what is the meaning of FEP is a fluorinated ethylene propylene. So in other version you can call it as a Teflon. Teflon is the name given by DuPont, so we cannot use that Teflon name. But Teflon is nothing but a fluorinated ethylene propylene. While in case of fluorotec barrier film, it is ETFE, meaning ethylene tetrafluoroethylene. So there are two different versions what we provide in case of barrier films. So moving to first lubricity. So lubricity is generally, so whatever stopper you get is generally having a lubricated version. Why? Because a slight amount of silicone oil is required for machinability purpose. So we put either 350 centistoke polydimethyl siloxane or 1000 centistokes polymethyl disiloxane PDMS. So for Europe region, there's mandatory to have a viscosity of 1000 centistoke. For US and Asia region, we generally give 350 centistoke PDMS. So why this is used is this is commonly used for all the stoppers and applied by tumbling as a having a low cost, but there are certain disadvantages whenever you are having this silicone oil on the top of rubber stopper. So this particle or droplet may be found in the drug products. So whatever we are putting on the top of this rubber stopper, this silicone oil can interact with your drug product, and silicone level may be
And we can't
consistent,
see
inconsistent.
we can't see the screen. Okay, so
Sorry, sorry, Kriti.
we can't see
We
your
can't
screen.
visible your screen, sir. Your screen is not visible.
Oh, okay, sorry. Now it's okay.
Yeah, okay, sir. You can.
Thank you. So, so all these rubber stopper are having a some amount of silicone oil, but that should be measured. The another way is a B2 coating. So B2 is a version which is given by our partner Daikyo Seiko. So what is B2 coating is coating with high molecular polydimethyl siloxane cross-linked on the surface of this rubber closure and then curing with UV light. So because of this curing, you will not see a subvisible particle on the top of this rubber stoppers. So generally we recommend B2 coating for all this because there is no subvisible particle present on the top of the rubber closure. And it also does not alter any chemical or biological stopper properties. So this B2 coating capabilities are there in Europe, Japan and US. So these are the two versions what we provide for lubricity, one with silicone oil, the other with B2 coating, which is nothing but a high molecular weight polydimethyl siloxane and curing with UV light to avoid any subphysical particles. So there are various versions we provide. So you can see three different versions. So one is B2 coating with 4 and 0. So 4 meaning there is a coating applied on the top of the stopper. So on the bottom you will not have any coating. So bottom surface not coated, so level 0. So it is not 4 for T, it is level 4 on top and level 0 on the bottom. So in case of B2 4-2 meaning there is a full coating on the top but there is a half coating on the bottom. That's the reason the numbering is B2 4-2. And in case of B2 4-4, the top surface coated to maximum level. So there is a level 4 coating on top and also there is a level 4 coating on the bottom. And that's the reason the nomenclature is B2 4-4. So these are the different versions we provide this rubber stopper. So B240, B242 and B244. And basis on the requirement of drug manufacturers, so to improve the machinability, to improve the to reduce the subvisible drug particles, so subvisible silicon particles, we generally give this silicon, this B2 coating on the rubber stoppers. Moving to barrier coating. So whatever we have seen is improved the lubricity, and this is mainly to barrier property. So there are two different films, ETFE and FEP. Like I mentioned, Fluorotec is a ethylene tetrafluoroethylene, which is a hydrophobic coating, which is having a flexible film available in all designs. So you can see the serum version, lyo version, plungers. We can apply all this ETFE coating. In case of FEP film, because it is having an inflexible film, it is only available in the flat surface. So this Teflon or FEP, fluorinated ethylene polymer coated, you will not get in the lyo stoppers. So it is only used in a flat surface because the film is inflexible. That's the reason you will see this film is available only in serum stopper, not in lyo stopper. So you can see in the picture there are few lyo stoppers. So like I mentioned, there are 4 different stages for lyophilization: pre-treatment, freezing, primary drying and secondary drying. And this is the version we generally recommend for lyophilized stopper. So you can see during a primary drying, when there is a apply of pressure, because of this pressure and vacuum, certain stopper can you can see on stick on the top of this chamber. So to avoid this, we generally recommend to have this B2 coating. That's the reason this stopper will not stick on the top of this machine. So B2 coating is generally recommended for all the lyo stoppers. Just to avoid this, it will not stick on the top of the chamber. Fluorotec laminated and untreated. So you can see the Fluorotec lamination we can give on the bottom or we can give on the top. So this is ETFE, like I mentioned, ethylene tetrafluoroethylene. It is having a very good barrier between drug and closure, which will reduce the leachable from elastomeric component. It also provides lubricity without the need for silicone oil. So once you have this coating on the top of the stopper, you don't require additional silicone oil. It also reduces clumping and sticking to lyo shells. So like I mentioned, because of this coating, you will not it will not stick to the lyo chambers, lyo shells. Lower particle, superior functional performance, transparent and can be radiated, ideal in combination with B2 and minimize product loss of. Recommend have coating on top just to avoid the sticking in the lyo chamber. Moving to a design parts. So certain things you might have not understood. I'll take you. There are two different designs.
Vikrant, your screen is not visible here.
Sir, your screen is not visible.
Sorry, can you see now?
Yeah, yeah.
Yeah. Moving to design parts. So whenever you see any rubber stopper, there are two different sides. So this is called serum stopper and this is called lyo stoppers. So this version is called as a plug, which is in contact with your drug, and this version is called as a flange, which is on the top of the vial. So this plug side will be always in contact with your drug, while flange is at the top side. So, like I mentioned, there are different versions, designs available on this rubber stopper. So, serum. So, this is the serum stopper, the Lyo version. So, in the Lyo, there are different versions. What we call it as the igloo. So, single-legged or igloo. This is a two-legged or three-legged, and this is mainly used for a lyophilize technique because there are, like I mentioned, different phases. So you need half stoppering in that segment to to remove the excessive water on the second primary drying. So that's the reason you see the height of this lyo stopper is comparatively more compared to the liquid version. Why? Because in the lyo stage you need half stoppering during the process. There is also IV stopper, and this what we just see is the laminated version. And there are different sizes available. So the sizes are available are 13 mm, 20 mm, 28 mm, 32 mm, and others. So 13 and 20 mm are the common standard size what we generally have in this parental packaging. And the vial type, there is a no. There is also options of blowback or non-blowback. So in the blowback, you have European design and US designs. So these are the different types which is available. So if your drug is in liquid stage, we generally recommend this serum stopper. And if your drug is in the powder or lyo stage, we generally recommend this lyo stoppers. So this is the blowback version. So this blowback is mainly called as for the vial. So in the US blowback, there is one cut, while in case of European version, you will not see a cut over here. So there is a difference between US blowback vial and European blowback vial. And all the stoppers is having one anti-pop ring. So whenever you put this stopper on the top of this vial, it should not pop out because of this anti-pop ring. So this is what we generally have, anti-pop ring on all the stoppers to avoid popping of these stoppers during manufacturing process. Moving to lyophilization. So the single vent is called a igloo design. So this is if you can see, it looks like an igloo. That's the reason we call it as the igloo. It is stable when placed on the vial and can get out of the axis when closed. So there is another version, igloo, or you have a two-legged, meaning you have two legs on the stopper. So there are advantages and disadvantages of each version. So single vented or igloo is the one which we generally recommend because during a transit or during a process, these two-legged can intertwine with each other and will not give a kind of a easy processing. So our recommendation is generally with the e-glue will not intertwine with each other and the process will remain smooth during stopping process. And the number of vent. So like I mentioned, there is a one-legged, two-legged or three-legged. So number of vent is not a rate limiting factor to sublimation in the lyo cake. So even if it is a igloo design or two-legged design or a three-legged design, this is not a rate limiting factor in the sublimation in the lyo process. So number of vent has little impact on the lyo process. So if you use one-legged, your lyo process will be easier. There is no study. So we have an internal as well as external study in both the cases. So number of vent is not a rate limiting factor, and the impact of all one, two, or three-legged will be same. So number of legs, number of vent is not an important factor while considering for lyophilized versions. So in case of lyostopper, you can see the one which is in purple, there is a B2 coating. So B2 coated version, and the top there is a laminated fluorotech version. So you can coat on the top, you can coat on the bottom. So both side you can give the film. So this few people just want to have a coating on the bottom side, but like I mentioned in the process lyophilization version, if it is coated, so it will not stick to a lyo chamber. So for lyophilization, generally top and bottom coated is recommended for smooth processing. Post processing and packaging. Meaning finishing and packaging. How does the stopper fit into the drug manufacturing line? Does the drug manufacturer prefer wash, siliconize and their own stopper? So meaning once you have this coating, once you have this lamination, how we are going to supply it to the customers? So whether there are various versions, few customer want ready to sterilize, few customer want they can have their washing at their own site. They can, some people don't want that siliconization. So it's all depending on the drug manufacturer how they want this rubber stoppers, and basis on that we generally provide this rubber stopper. So what type of sterilization is used? Whether it is steam sterilization, whether it is gamma sterilization, that is also important factor in determining the packaging of this rubber stopper. And what kind of filling line is used. So these are the important aspect which we generally take from the drug manufacturer before giving any kind of a sample to drug manufacturers. So three different versions we give to customers. One is a standard grade, meaning no water for injection wash, meaning there is a wash and siliconize at their own stoppers. So we just provide the stopper, and the manufacturer or this drug manufacturer can wash on their own. That is called a standard grade. This other grade, ready to sterilize, meaning we wash at our side and with the water for injection and then siliconize, and then customer or the drug manufacturer can sterilize on their own at their premises. And there is another ready to use grade which will totally eliminate all processing steps and go straight to filling line, meaning we wash it, we siliconize it with a pharmaceutical washer and then sterilize it, so which can directly used by a drug manufacturer. So it all depending on the what kind of manufacturing facility the drug manufacturers have. So they can take the standard grade, ready to sterilize grade or ready to use grade. So there are two basic differences when we select ready to sterilize, which is RS grade or ready to use RU grade. So in the ready to sterilize grade, we check bioburden, endotoxin, particulates and silicone oil for all the batches. So what is the meaning of bioburden? So bioburden is the number of bacteria living on the surface of the stopper. So we check bioburden for each lot on the RS grade. We also check the endotoxin. So what is the meaning of endotoxin is? It is the type of pyrogen and component of gram-negative bacteria, which is kind of a E. coli. That is also we check for each lot. So particulates, whether there are any particulate present in the rubber stopper, that is also we check for each lot. How much level of silicone oil it is recommended, basis on the machine what they have, whether they require level 1 coating, they require level 2 coating. So that is what we generally provide, or we check for ready to sterilize grade. And in terms of ready to use grade, we check the sterility. So meaning we check whether the stopper can be ready to use. So we check all the sterility in the rubber stopper, including all the tests which I mentioned in the RS grade. So additional sterility is checked for ready to use grade. So all these grades like Vesta RU, Vesta RU Select and Vesta RS comes with a DMF filing. So DMF filing is drug manufacturer filing. So all for all the grades we have this DMF filings. Type of sterilization. So this is also important. So without sterilization, no pharma manufacturers generally use these rubber stoppers. So they can use either steam sterilization or a gamma sterilization. So we understand from the customer whether they are using steam sterilization or gamma sterilization. If they are using steam sterilization, then we generally give a autoclavable bag with the material which allows steam to pass through. So that is called a Tyvek. So we generally give, if the customer uses steam, we generally give in this autoclavable bag. If they are using gamma sterilization, we generally provide with a clean polyethylene bag. What kind of feeling of this manufacturer does they have? So for normal feel finish line, what we call it as a bulk packaging, we provide in sterilizable bag or polyethylene bag. But if the manufacturer is having RABs, which is restricted access barrier system or isolator, we need to provide the stopper with a port bag. So this is the port bag which is generally used for RABs or isolator system. While in case of normal fill finish, we generally give in a sterilizable bag which is having primary and tertiary, and over that we have a primary, secondary and tertiary bags on top of that. So this is in a general summary. So what we are seeing is what is the elastomer. So what kind of elastomer we are used, whether it is the IR, NR, BIR or CIR, which is chlorinated version or brominated version. We also seen what is the mechanism, manufacturing process. So these are different steps. So weighing, mixing, calendaring, molding, trimming. These are the steps what we have seen in manufacturing. And once it is manufactured, how it is kind of a given a coating in terms of lubricity or coating in terms of barrier aspect. What all different coating levels are there in terms of B2, B2 40, 44, 42. What are different fluorotic films which is available on the top, flange section on the bottom. So that is also we have seen. So also we have seen how it is kind of a manufactured and how it is kind of a transported to a drug manufacturer. So if they are having normal fill finish, we provide in a steri bag. If it is RABs or isolator, so we generally give in a port bag. So that is what we have seen in post processing and packaging aspect. So this is a general summary what we have seen for elastomeric closure, a rubber. So I have few challenge questions now for you. I hope you understood all the details, because in detail I don't think so you'll find this kind of detail in any pharmaceutical book. So this is kind of a very detailed on stopper, mainly focusing on the elastomeric rubber stoppers. So how it is going to manufacture, what are the process, what is the post processing, what we had seen in this segment. So I'll just have five challenge question for you. I request everyone to be interactive, post your answer on the chat box. So first challenge question is, airtight sealed containers are used for. So I'll give 10 seconds. I request everyone to answer on this challenge question. So, Kriti, can you request, please just check that?
Yes, yes. I mean,
Yeah, any answers? Majority of answers are?
yeah. One has replied injectables.
Yeah. I request everyone to respond because this is very important whether you understood this topic or not. The right answer is injectable, correct. In injectable, you need to be have airtight sealed container. The second challenge question is common rubber used in pharmaceutical packaging. So whether it is butyl rubber, chlorobutyl rubber, silicone rubber, or all of the above.
They've written all of the above. Fifth,
Yeah, the right answer is all of the above. You can use a butyl or chlorobutyl or silicone rubber also in a pharmaceutical rubber closures. Moving to third question, what is the full form of IR or IR and BIIR?
for B,
Any right answers?
yeah, for BIIR, I got brominated isobutyl isopropene rubber. Isobutylene isopropene rubber. Yeah, for IR, I have got an isopropene rubber, and for BIR, I got bromobutyl isobutylene isopropylene rubber.
Correct. They are correct. So IR is isoprene rubber and BIR is brominated isobutylene isoprene rubber. Moving to fourth question. A B2 coating is used as a barrier film. True or false?
So they have replied true. Most of them replied true.
Oh my god. So you mean to say you're not heard that. So B2 coating is generally used for lubricity. It is not used for barrier films. So FEP and fluorotech is generally used for barrier film while B2 is mainly used for lubricity. So the answer is false. So B2 coating is not required for, it's not given for barrier films. For barrier, we have FEP or fluorotech coating. So the answer is false. The last question. The number of vents are rate limiting factors in lyophilized stoppers.
Someone has replied two. I guess it's false.
Yeah, the answer is false because in the lyophilization stoppers, like I mentioned, whether it is one-legged, two-legged, or three-legged, it doesn't matter. So what matters is the rate of sublimation inside the vial. Whether it is two-legged or three-legged doesn't matter. So the answer is false. Okay. Okay, moving to you, Priti. Thanks everyone.
Anyone has any question regarding the session? Please type in the chat box below.
Students, anyone having any queries, please put in your chat box. Madam, before someone asking some questions in the chat box. Sir, by using this kind of device to inject a drug into our body, I agree with your answer. Sir, that is reduces pain and make comfortable.
Any question, Maheshwari?
There was one question asked by. So it was, sir, would you say that it is made up of elastomers, not rubber? But I have a doubt that by using these kind of devices which are made of plastic, will it be affected?
Sorry, I didn't understand the question actually.
Yeah. Um, yeah. So one question was, it is as you mentioned, it is made of elastomers and not rubber. I have a doubt that by using these devices, which is made of plastic, will it be affected?
And this one is from YouTube question.
Okay, and one more question from YouTube we got. In case of lubricity, silicone oil is used in different viscosities at different places. Why?
Yeah, so in the PPT you're seeing that for Europe it is 1,000 centipoise and for US and AP it is 350 centipoise. It is like they have standardized this. So from since many years they are doing on the 1,000 centipoise. So they kind of standardize their process in 1,000 centipoise, while US and Asia region we followed 350 centipoise. There's no standard requirement for this. It's just a traditional way of what they are doing, and we are following that same thing. That is the reason in Europe you see 1,000 centipoise is the one silicone oil viscosity they follow since ages, and for US and Asia Pacific we follow 350 centipoise silicone oil viscosity.
Okay, so there's one more question. What is meant by gamma sterilization?
So there are three different sterilization process. First is steam sterilization, gamma sterilization and ethylene oxide sterilization. So to kill all the microorganism present in your system, or since this is a aseptic process, we need to kill all these microbes present in the top of the stoppers or in the vials. So these sterilizations are required. So gamma is the one which is given uh, for killing the microorganism present in the uh, stoppers or vials.
Okay,
What's
and
the
one.
relationship between elastomer and rubber? So in a traditional way, elastomer and rubber are interchangeable. So I mentioned in the slide. So elastomers and rubber you can interchange it. So both are having a elasticity. So rubber is having also elasticity or elastomer. This is just a nomenclature what we have given it, but you can call it as elastomeric stopper or you can call it as a rubber stopper. Both are interchangeable. So both answers are correct.
Any more
Students,
questions for
anyone
Tanvi?
having any queries, please respond. Please respond in the chat box. Students, please respond. Anyone having any queries, please respond. Please put
So there's one more question in. Elastomers has the same nature when compared to plastic and rubber.
No, plastic is something which we are not discussed. So plastic is different and elastomers are different. So there is no correlation between plastic and rubber.
students, anyone having any more doubts, please put in your chat box. Please, students, please respond in the chat box. Students, please respond. Anyone having any queries? Students, please respond. Anyone having any queries, please respond in the chat box. And students are telling no, ma'am.
No more questions.
Okay, then it is no question, so we can close for the day. And we are going to see tomorrow the secondary seals and devices.
Yeah, we got one more question here. Are rubber stoppers recyclable?
Recyclable? No, no. It's a
Recyclable.
one-time use. We can't use because it is already in touch with your drug product. So once it is in touch with your drug product, we can't use that rubber stop.
Okay.
Students, please respond. Anyone having any queries? Otherwise, we shall we
Yeah.
close the section.
We'll keep the session for 3 minutes more. If anyone has any questions, this will close by 4:15.
Students, please respond, and I have given the feedback form in Facebook, YouTube, and Airmeet also. Please check it and submit the feedback form. Based on that only, we'll provide the certificates. Please check it. Anyone having any queries, please respond. Otherwise, put in a chat box. No doubts. We'll close the section.
We got a question. What's the use of IR and BIR?
Yeah, we discussed in the slides. IR is the isoprene rubber and BRR is the brominated halogenated butyl rubber. So isoprene rubber is having some sort of tendency in terms of a moisture or vapor. So butyl rubber is the one which is generally used, which is having a good amount of barrier properties when we talk about oxygen or water. So butyl rubber is having an excellent barrier property. That's the reason we as the West generally recommend to go with butyl or halobutyl rubber, not the one with isoprene rubber. There are some challenges with isoprene rubber in terms of poor resistance to oxygen and water. That is the reason brominated or chlorinated or brominated rubbers are generally recommended.
Okay. So there are no more questions now. So I guess we can close the session
Yeah, okay,
for the
ma'am.
day.
Okay, ma'am. Okay, students, you are not having any queries now. We are going to close the section. Thank you, everyone. Thank you, madam. Thank you so much to everyone. So, section. Everyone leave the section.
There is one suggestion from Vasanta. Need more pictures in slide for better understanding. Okay, we will see that definitely. Thanks for suggestions. Okay, thank you. Bye. Bye, everyone.
Thank you, sir. Thank you so much.
Stop. Okay.
Thank you, everyone.
Madam, students are asking PPT will be provided or not.
Okay, ma'am, I'll get back to you today by today's end
Yeah,
on that.
okay. Okay. Students will after confirmation I will send the PPT to your mail. Okay. Please all of you submit the feedback from BSL on that only we'll provide the certificates. I have posted in the YouTube, Facebook and Airmeet also. Please check it.